Hello, everyone. Greetings. Thank you for taking the time to join us for the very important webinar, The Pivot Moment, Advocacy in Action. It will be the last webinar of World Patient Safety Day series. As a patient and families impacted somehow by harm, we advocate for patient safety and repairing the trust. We can change how we respond to healthcare harm by shifting the focus from what's happened to how we can part of it. This is your opportunity to hear about innovative approach of advocacy in our kingdom. First, allow me to introduce myself, Makia Majrashi, Patient Safety Specialist, representing the Saudi Patient Safety Center. I'm working in healthcare sector since 20 years, 6 of them in Saudi Patient Safety Center. I have a master's degree in business administration, minor total quality management from University of Leicester. I'm a part of a team working with Patient Advocacy Council since 2019 until the present. We are a group of individuals committed to engage with one another, sharing ideas, expanding the engagement of patient advocate leaders in the Beryl Institute community from different entities around the world. I'm certified in patient safety, patient experience, also in CBHQ, as well as change management and KPI. Our second speaker, Shuruk Beloubaid, Health Education Specialist at Ministry of Health. Shuruk holds bachelor degree in Health Education and Promotion. She has also a master's degree in Health Administration, College of Health Science, Saudi Electronic University. She is certified in CBHQ and employed at General Administration of Clinical Health Education, Ministry of Health. And our third speaker, Yasmin Jihani, Regional Operational Lead at Greater MENA Axios International. Yasmin graduated from a master's degree in Healthcare Administration from King Abdulaziz University. She has a Bachelor's Science Integrated Health Studies with concentration in Healthcare Administration and minors in Business and Management from Kent State, US. Yasmin is leading and overseeing business development, client relationships, and project management for all Axios Healthcare Access programs in Kingdom of Saudi Arabia. Yasmin has more than 10 years experience in patient relations, project management, healthcare industry, and she is supporting the implementation of healthcare programs in Kingdom of Saudi Arabia and directly working with patient healthcare providers, hospitals, all stakeholders related to this work. She is also focusing on patient support programs and she is certified in THI Health Seniors Instructor. First of all, let's start with sharing with you the objectives. Can you move next? Yes, ma'am. Our objectives today, we'll talk about the patient engagement strategies in healthcare settings. We'll explain the role of patient support groups in primary healthcare center and describe how patient support group can improve patient health literacy and empowerment. Then we will end up by lessons learned and how can advocacy really lead better health decisions. Let's start with identifying what is advocacy. We have been hearing this word long time, but what does it really mean? It's define an action that speaks when you speak about somebody else, taking the lead of a case and speaking on behalf of others, taking this speech to improve someone healthcare system and lead people that can have an access to affordable, effective, and high quality healthcare. When we have lobbying, does it mean this is an advocacy? Not all advocacy is lobbying, but all lobbying is advocacy. Next, IHI defines a patient advocate as a supporter, believer, sponsor, promoter, or a spoken person. They can be partners, friends, client, somebody talking about the case, as we said, like a chronic disease, managing the new diagnosis or transition of care. Let's start with second speaker Yasmin Al-Jihani to listen from her perspective as a believer of one of non-governmental organization. What does advocacy mean to you, Yasmin?
Thank you, Makia. It's a pleasure having me being with you here at this webinar. I'm glad that I'm here with you today to explain from my point of view what it means to me. First of all, I would like to start with a case study of two patients that I've encountered personally through patient support programs. The first patient had a disease that has silent attacks. When I first contacted the patient to introduce patient support programs and ask the patient if she wants to enroll in the program, I found out that this patient has not visited a hospital for 5 years. She has even stopped taking her treatment for the past 5 years. I've explained to her, have you done at least the laboratory work to see the progression of there has any silent attack had happened? And with that, she responded with no. So trying to set the baseline here, she had a disease that is a chronic disease with silent attacks and has not been able to visit. She was able to visit, but did not take the decision to visit this hospital. The second patient, on the other hand, she knew about her disease and she was visiting her hospital regularly. But on the other hand, her treatment was an injection, subcutaneous injection. She was afraid of needles, so she did not inject herself ever. And she used to rely on her caregiver to give her that medication. If the caregiver comes late and is tired, then she does not take her medication. Even if he is traveling, she does not take her medication. So this patient treatment was relying on other, not on her patient. Taking from these two stories, we understand that many of the patients are not adhering to their treatment, and that is limiting the cost effectiveness and sustainability of the interventions. And also, we get to understand that the healthcare system is also not set for chronic disease management. The patient is well treated at the hospital, but once this patient leaves the hospital, then that patient, the communication with that patient is very limited until the patient gets back either stable or with complications. The Saudi Vision realization, the Saudi Vision covers that and realizes that by talking about the collaboration between health and social care, by providing the patients the care at home. And with that, we can ensure that the treatment is given outside the direct treatment process and beyond the hospital setting. With that, we encourage the holistic approach. The second vision tells us about the access to medical services and how it can reduce the waiting time and need of appointment with specialists and consultants. And with that, we understand and we ensure that the needed support is provided to patients. And we're here talking about both the access and the stay on treatment for the whole course of treatment. And we're even for the chronic diseases, how we can cover that. The last part, and it's not the one of the most important parts as well, is the doctor and the HCP's training and how they are well trained to cover the chronic diseases and how they can treat it and how they can engage with those patients to ensure that they empower their patients to adhere to their medications. So how can we achieve that? How can we get those patients to adhere? How can we improve our healthcare system to be fit for the chronic disease patient? That we can achieve by 3 pillars, which is maximizing the medical benefit, the financial and operational sustainability, and the compliance with the local regulations and international standards. And we're talking about initiatives that is customized for each patient, not a simple service that is provided to all patients with the same care. So first of all, if we cover the medical benefit, how we can maximize the medical benefit, and that we can do by understanding the needs, the challenges, the barriers, the struggles that the patient faces throughout their journey. And that journey should be based on evidence-based science. The second thing is understanding how to address each patient needs and challenges. Okay, we mapped out the journey, but do we know how to address these specific needs and translate them to services? So WHO defined adherence as the degree to which a person's behavior corresponds with the agreed recommendation from the healthcare provider. So how can we change the patient adherence, how we can improve it by creating the environment that the patient can support the patients. And we do that by engaging the patient with the solution that supports that patient. We're talking here about solution that is customized, personalized to the specific treatment journey of the patient. We empower the patient. What is the needs of that patient? Is it education? Is it logistics? Is it remote services? We need to understand and figure out those needs and then translate them to the exact service. We should empathize with the patient. We should listen to our patients and not only listen to them, we should also be able to live in their journey so we can guide them and be their trustworthy partner or advisor so we can help them to go through it and be able to live with it. Then we need to enable them, and that will not only support the patients, but also will minimize the burden on the healthcare system itself. And it will also support us by being proactive with the patient. Support the patient by being proactive. We do not wait for the patient to come to us with questions. We initiate the communication with that patient, so we understand the journey better, and we help the patient to figure out or specify what are the needs, even if they did not realize it. So how do we do that? How do we identify those needs? How we help the patient to identify and speak up about these needs? We use at Axios 2 methodologies. The first one is the 5 dimensions of adherence, which is scientifically proven by the WHO. These 5 dimensions starts with the social and economic dimension. And here that is not related to the disease itself, it's related to the social and economic status of the patient. Is the patient able to go to the hospital to afford the consultation, to afford the medication? And if that is available, will the patient be able to go engage with the public or be able to travel to a specific hospital to do it? The second therapy related is the medication. Is it a tablet? Is it an injection? Is it a chemo? What type of therapy is it that is provided to the patient, and how is the route of administration? How can we support the patient through this dimension? The third one is patient related, and we're here talking about the patient beliefs, the patient point of views, how the patient perceives. The third one is the healthcare team and system dimension. And we're talking here that the capability of the healthcare system in terms of pressure. Is the hospitals or the specialties hospital available close to the patient? Is it far? Is the transfer from a general hospital to a specialized hospital easy? Is it not? The last one is the condition related, and we're here talking about with the type of the disease. How does it translate to that patient? Is the patient able to function properly, easily as anyone who is going through their days, or is that patient a handicapped patient? Does the patient need support to go around, or is the patient capable to do it himself or herself? Are the patients able to engage with the wider society? The second one is understanding the 6 stages of patient journey, this one is developed by us, by Axios, based on actual real patients who were engaged in our patient support programs. The first stage starts with the disease awareness. And here we're talking about the first show of the symptoms and the signs. Once a regular person starts sensing that there's something not quite real, like there is a specific sign or symptoms happening that the patient starting to feel ill, does the patient at this point have the knowledge to go to the hospital, knows that the patient requires to go to the hospital, to the ERs, or does the patient have to go to a pharmacy just to get an OTC medication and will figure out? Is there any way to support that patient through this phase? Can the patient communicate with someone to ask, I have these symptoms that I'm experiencing. What should I do? The second one is the facility access. And here, where if the patient understands at this moment that this patient needs to go to the hospital, when we at the Saudi, it's a huge geographic area, and there are lots of areas that the patient lives at, but it does not have a close by healthcare center to cover specific chronic disease areas other than primary care for specific diseases. So if these patients go to their primary facilities that is close by, can these patients be transferred to the other specialized facilities or not? Is that required or not? Do they will are they able to do that, to travel, to experience the whole experience? Is it easy? Is it not? Is there someone to support during that journey? The third one, the patient is diagnosed now. He knew which physician to go to, and that physician diagnosed the patient. What now? Does the patient require to do lab work to confirm the stage of the disease, the medication that needs to be taken, the options that are available, which one is best suited for that patient? Will the patient have the knowledge to participate in the decision making? Medication is it's prescribed. The patient now knows what medication and decided with the help of the HCPs and the medication that is required to be taken. Will the patient be able to afford it? Is it available in the country? Is it available in the city? Is it easy to receive that medication? Will it be easy the next time? Okay, then we reach the fifth stage, which is the medication purchase. And at this point, we understand that some medications or some innovative medication will be available in some healthcare facilities, while it will not be available at others. So again, is the treatment available? Is it easy to get that medication, to purchase that medication? Is there anyone to support with that? Will that patient be able to receive the medication on time? If the patient is diagnosed on a later stage, will the patient be able to start immediately, or is that delayed? Then we reach the last stage, which is the adherence stage. And as I defined the adherence before, will patient be able to change their behavior to live with the disease? Is there anyone to help them and support them with that? So why we need this patient journey and why we rely on the dimensions? Because this will help us to do a customized service. And with that customized service, we will be able to formulate a personalized plan that is specific for each patient. Back to you, Makia.
It's quite interesting, sure. Yasmin, sorry, how you go to detailed and customize the patient journey according to their needs and preferences. Now, we're gonna have a look at what Shuruq Al-Ubaid, General Administration of Clinical Health Education, did in primary healthcare center.
Hello all.
Yeah.
Yes. Thank you, Makia. Hello all. It's a pleasure to be with you here. Thank you for the opportunity, Saudi Patient Safety Center. Um, as uh, as Yasmin said, we have a customized service provided by the Ministry of Health, and it's called a support group or ihtimam in Arabic. A support group, it's a group of people who had the similar experience, especially difficult ones, and who provide to help each other. ihtimam groups, it's translated as a translation in Arabic. ihtimam is a caring, as the government is caring about their citizens, and the Ministry of Health is providing the care for her patients. This project aims to strengthen the principle of community solidarity and involve community members suffering from chronic or rare diseases or their families with healthcare providers in this process of improving their health. So even physical, psychological, social health, and even empowering them as an essential. Sorry, Yasmin, if you can go back to the main slide, the support group, ihtimam. Thank you. It's about the support group. It's a part of empowering the patient and letting them taking care of themselves, take good the good social support from others who have the same disease. It's essential part of the process by forming groups for patients who share the same health condition or their families, as said, to meet among themselves and exchange experience and uh, psychological social support. After that, one of the objectives of the support groups for next, we have the types of support group. One of them is emotional support and self-development. Also, social support is provided by the support group. Also, educational support. So educational support can be given through the health care provider, the facilitator of support group, always leading all the group to have the good knowledge, the correct knowledge by, if support group members are only sharing their experience and their struggle through the disease, the also somehow they have some wrong informations. Always the healthcare practitioner is there for them to have the educational support. And support health and support group program, we have three main objectives. It's to improve, promote, facilitate. First, improve is we are concentrating in improving the work of support group by increasing the satisfaction of the services for the beneficiaries of the support group. Also, we want to promoting the concept of support group between community members participating in support group through the required activities. The last objectives is to facilitate. We are trying to facilitating the access for services individual in the support group by making electronic digital support group available for all the patients. In support group program, our main scope is include but is not limited to chronic diseases and also autoimmune diseases and healthy lifestyle. For the chronic diseases, we are mainly focusing in diabetes, asthma, and obesity. Because we are mainly working in the primary health care, and these are all the chronic patients also monthly going to the primary health care. For autoimmune diseases, we have groups for HIV, support groups, and also for healthy lifestyle. Sorry, for the healthy lifestyle, we have support group for breastfeeding for new moms. We also have support group for physical activities, for cut smoking support groups all over Saudi Arabia. After Yasmin will continue.
Thank you. Thank you, Shuruk. It's quite interesting how you're really working as a holistic approach and trying to target all the needed services for all the support group. So definitely these support group have an impact on the quality of lifestyle for our patients and families. Let's see the beneficial or the financial benefit of this support group from Yasmin perspective. Yasmin, are you with us?
I'm here, Makia. Thank you. Thank you. And it's quite interesting as well, Shuruk. It's nice to experience how you develop this the scope of this group, Ihtimam group, and it's a wonderful name to use. Who wouldn't like care? Even healthy people would like to have care. So congratulations on this one. Okay, how can we have this one implemented? As you said, Makia, we need to focus on the financial and operational sustainability. So to have this service and or the activity available for the patient. That's what we call patient support program, to deliver a specific service that is customized for patients and have it available, easily accessible, and it will maximize the medical benefit that we need. So it's a perfect example to patient support program. Okay, then how do we do that? How do we reach the financial and operational sustainability? We will be able to do that by examining again the different stages of patient journey and utilizing the multiple dimensional approach. Those two are very essential to be able to provide the service that is customized, personalized for our patients. So from a financial perspective or from an operational perspective, what is needed from our side? What are the pillars that should be there for that purpose? First of all, we will need the health authority supervision. We will need the program administrator who will be performing that patient support program. And in this case, Shuruk and Ihtimam Group is a perfect example. In our programs in Axios, we use the CSR of the pharmaceutical companies for funding. And I understand that Shuruk's program, Ihtimam, is funded by the resources of the MOH, which is internally funded. But if it was externally funded, that's just an example. And there are other multiple strategic partners who can invest in the success of such services, which is the charity and NGOs, the insurance, the distributor, or the pharmacies. Back to you, Makia.
Okay. Now we are going to describe the patient support group, how they can improve the health literacy and empowerment. Can you go next?
Okay, I'll take that back from you.
That's fine.
Okay, so first of all, the healthcare system started with the simplest services that is provided to the patient, and even the funding for that was a donation model. Then there was the revolution for the people who cannot get the reimbursed. So those population were covered. That was an increase, and then now we're at the holistic patient support model, how we can provide not only affordability or availability of treatment, but also include the treatment adherence, the disease management, and they ensure that the support that is provided for these patients will help them to live with their disease. So what we're talking here again is how to deliver that care outside of the hospital. So it would be initiated at the hospital. So how can we go beyond the hospital setting, how we can utilize the remote care that is now part of the Saudi vision and have it delivered to those patients in specific services to build on the therapy to a specific disease. All that with a customized care plan to help those patients achieve the maximum medical benefit. Go ahead, Makia.
Let me ask you, Yasmin, how is the feedback of the patient and families about your programs, since you have been initiating this since a long time?
I would like to tell you, Makia, that none of the patients, and up until today, requested to stop the being in the patient support program. All of them are there available, or of them would like to continue to continue within the patient support program, and most of them are encouraging the other patients to find a patient support program that is suitable for them and ask about it to their treating physician.
That really shows and increase the responsibility of Axios. They have to move forward and they have to increase the number of patient support group according to different and customized disease, isn't it?
Yes, definitely that is correct.
I think we really share the same passion and the same experience. Similarly to Patient Safety Caravan, we have been initiating this program or this project since 2019, with only piloting the Patient Safety Caravan in 26 areas or hospitals all around the kingdom. It has been started as an idea where we goes to patient and educated them about the patient safety issues during their admission and during their hospital visitations, how they can communicate in a very corrective way when they are communicating with their healthcare providers. Then we move to expand this idea outside the kingdom. It was also piloted in Pakistan. It has a great impact with 800 patients. It was really interesting to hear from our colleagues in Pakistan that it was a useful for effective communication between healthcare providers and patients. Although our healthcare providers get used to communicate with their patients when they are treating them and when they are sharing the ideas, but the patient safety caravan ideas was somehow customized to each areas. If the patient sometimes he is anxious and he is not even aware about what is going on in healthcare sector, and he sometimes forget what kind of questions he will ask. This caravan was having a leading questions for the patient, how they can communicate effectively with their healthcare providers. So we move from inside the hospitals and we move to TOT training, then we deliver and we transfer the knowledge to our healthcare providers so they can implement in their day-to-day business. Then next, by having those patient safety advocate from different sectors, we come up with a patient and family advisory council specified for patient safety. This is a newly council customized only for people with unsafe acts, how they can promote a patient safety concept and patient engagement around the community. So now we are expanding the concept of patient engagement and advocacy from hospital out and outside the hospitals. Not only this, we go to school. How you can imagine that promoting the patient safety around the schools. Sorry, let's here move to healthcare providers. So when we implemented the patient safety caravan, it was really an interesting questions from the patient, from the healthcare providers. They told us, we get used to communicate with our patients and this is daily work, but can you give us some tips and courses about how we can engage patient? Then we come up with this course in 2018. We conducted 6 sessions. It goes about different objectives like empathy, active listening, a lot of tools how we can really communicate with patients and give them the space to speak up and to ask questions and to be actively engaged with their treatment plan. Next. Not only this, how about reaching out the community? This competition was art and patient safety. It come up with one of our international conferences. It was an idea how we can have a situation analysis and give the perspective of the school student, whether they are in primary or intermediate schools. We give them an idea that you can Google about patient engagement and patient safety. Just search how does it look like in their age. It was mix of different education. Some people, they show that from their arts that they can speak up and they are part of the treatment plan. And the others, they show that we are still having a gaps of communication among team. So these are part of activities and advocacy activities that could be shared within community to increase and to promote the patient safety as well as the patient engagement. Can you go next, please?
Yes, sure. Kia, this is quite interesting. Quite of the example how you moved from the hospital setting to the HCPs to the community. That is quite interesting, and Shurug would love to hear your experience as well with the care اهتمام group.
Yes. For ihtimam groups, we have two pathways to register the patient who wanted to be a beneficiary from support group or ihtimam. First way is to by going to the primary healthcare or hospitals, the same doctor or the health coach assigned in the primary healthcare is giving them a brief and letting identify the support group for them. if they want to be a member of support group for the year, they can give them يعني they can go and present in the same primary health care. The other pathway is by registering in the MOH website. When you go to the MOH website, just searching for support groups, it will be shown on all the support groups in your area. Support groups is in all the country, all the 20 region. Just by clicking on your city, you can go inside, and then you go and if there is a clusters in your area, just go to the cluster, and then you will find the communication info. You just send an email if the patient want to go through support group programs or not. I will tell you some of the benefits of being a member of support group. Support group is giving you the knowledge from the real life and the real experience from other patients. Sometimes the patients are newly diagnosed with a disease and they are afraid to um, be in social. They feel like they have a stigma, or they are alone. Only doctors are giving them information, and pharmacy only giving them the medicine, and they don't know the enough knowledge or the emotional support. اهتمام groups give you all the emotional and the knowledge support that you need. Also, you feel if the members of the support groups feeling confident, comfort of being with others with the same disease. Also, they can find the motivation to maintain their health. We have a lot of patients that, so they are يعني they are sick of being sick. They struggling, and they have all this medicine for the rest of their lives, especially the chronic disease patients. Sometimes they lose motivation. The support group give you the motivation that you need from other patients have um, the same disease. Yasmin, can you go next, please? Here are some of the statistics of support group program or اهتمام program. You have here all the numbers of the support groups and the number of activities were done in the past 4 years. Uh, I don't know if I said or not, the support group programs is starting from 2017, but this is the statistics from the last 4 years. You will see in 2020 we have a drop because of the COVID-19. The COVID-19, we all, I think we all don't like that 2 years or into 2020. But for us, it's opened uh, a lot of opportunities for patients. After COVID-19 and the cancellation of the presence meeting, we opened the opportunity for virtual meetings through Zoom, Teams, and WhatsApp groups. They increase the members hugely. As, you see in 2021, it's doubled the patients because it's easy access if we have the virtual groups, uh, which conflicted on their health status and effectively. Patients now like to have the virtual groups more than the present group because it's easy to access. We the اهتمام group is there all the time. Whenever you need it, just يعني it's easier to have meetings than going to presence in the primary healthcare or any center. Uh, that's my journey. If you like to complete, Makia.
Yeah, thank you, Shuruk. It's me myself. I was a part of patient support group during COVID, and we have been in an experience with cancer support group. There was a dramatic change in culture and beliefs. People were registering and sending us like a private message. They want to join, they want to hear more about the other success story of other peers groups, because that time all the focus of healthcare sector was on COVID, and those cases were the priority. So people need to hear from other how they can deal with their day-to-day life, how they can react, respond. And we have been working with really professionals who were supporting the patient support group, like health educator, oncologist, psychologist, social worker. All those people were successful with Mutaafi patient support group. We have been targeting more than 7,000 only in 6 months. So I totally agree that patient support group have changed the culture of our community and our patient as well. Now we'll hear from Yasmin. How about your experience with educating healthcare providers about empowerment and engaging the patient?
Thank you, Makia. Shuruk and Makia, what you said is very valuable, and we have experienced that ourselves in our patient support programs. One of the services we provided within the patient support programs is the support group and patient forums. And we found out that patients started to propose topics, what they want to talk about, what they want to engage with us about. And all of that started, as you said, with healthcare professionals like HCPs around the kingdom who just took the initiative to do it. So all what we need to do now is to empower those healthcare practitioners to start these patient support programs, to provide them with the tools to teach them how to understand the patient journey, how to identify those needs, how to provide those solutions. To do that, the second step is to visualize the journey and from different point of views. So they need to understand the physician perspective in that throughout the patient journey, the patient's perspective, the caregiver's perspective, which is one of the very important yet sometimes neglected point of view. The regulatory, of course, and the governance and the pharmaceutical as well, because each one of those has their point of view. Even the other stakeholders have their point of view. Those are just examples. Once you understand that, you understand what is the access solution or the framework that you need to do. This will help you to address, as we said before, to address those solutions. And then you start to implement them. At that point, you deal with those, you provide those solutions to real patients, and you get your success stories. At this point, you can identify the benefits, you can identify the risk, you can improve your program, you can maintain the compliance and efficiency, and then the sustainability. By that, you describe how the access solutions are structured and successfully operated. You know now how to be able to start your own patient support program if you focused on these objectives by empowering those healthcare practitioners. So how do we do that? That's a very scientific. Let's simplify it even more. First, if you want to do a patient support program, then you need to get the permission. So we need to, as decision makers, we need to give permission to allow HCPs to start their own patient support programs. Of course, it needs to be simple, as much as it's simplified as the perfect example that Shuruk provided, patient support program. It's not very complex. It's with a simple registration. It provided all the tool in an easy way, yet very comprehensive and well-structured way. So this is what she did as a third. She gave it a structure. She gave it rules. She gave it concept. She encouraged it to focus on the meaningful SMART goals, which she described at the very beginning as her objectives and scope. And she kept at it. Even during COVID, she said it got decreased in 2020, but it did not stop. And that made patients want to double and to know more after COVID. And it continued up until now. Back to you, Makia.
Thank you, Yasmin. So I think we have been sharing you a lot of real examples, hands-on experience from our expert, whether governmental or non-governmental sector. That's an area where we could share scientific strategies about engagement in all healthcare settings that couldn't be without local regulations, and international standards. And these cannot be done without leadership support and commitment. And we are lucky to have Engineer Fahad Al-Jalajal, our Minister of Health. He is a believer of patient empowerment and patient engagement as well. So we could have a very successful global patients action plan. If we move to next slide, please, Yasmin. So in Global Patient Safety Action Plan, strategies for engaging patients and families, you can have it a look at strategy number 4. It's really summarized to you what are the roles of government, healthcare facilities, stakeholders, and WHO secretaries. So each one of us have a role in a way or another. Can you move next, Yasmin? The other slides, please. So what are the government roles? If any country wants to apply and implement the patient engagement strategy, they have to think how to develop a national patient safety rights charter or bill with legal standing to include concepts such as patient rights to safety, respect, the care information, and all things needed for respectful care as a human right. They have to embed the WHO framework and integrated people-centered healthcare services in the design of their healthcare service. They have to create a formal mechanism to include patients and families in a national governance mechanism, working groups, task force, committees, action plan, so they could come up with a design framework, create alliance with existing patient and civil society organization on patient safety. They have to embed patient and family engagement in the standards, in the national standards or international standards, embedded and include goals related to patient and families engagement as a key components of short long-term plans. Next, please. If you attended the last global conference for world patient safety, you could see they start to announce the patient safety charter. So WHO is going to help us as a countries to have a general framework how the patient safety rights should look like in each country. They will give us the framework, and we have to customize it ourselves according to our needs and our culture as well. Next, please. Then our model of care, new model of care design. This is an international standard, and you can customize it to your care. We are lucky to have our healthcare transformation plan is including the model of care as one of the main framework that could be implemented in our healthcare sector. Not only this, we are also having Saudi standards for human-centered care, which is completely customized according to patient needs and preferences and how each healthcare facilities have to work on it and to respond to patients and families' responses, preferences, and needs. Next, please. The role of healthcare facilities, they have to involve patient and family representative with experience of avoidable harm in healthcare in designing strategies and defining actions to reduce the reoccurrence. Appoint patient and families representative to be part of organization support committees, and we are moving very strongly toward formulating this, rearranging the care process, and whenever necessary, reorient them how to make service patient-centered care based on the principles of what is important to patient and their families, create patient and family advisory councils with a focus to patient safety as what have been done in our Saudi Patient Safety Center, develop procedures around the provisions of a national charter or bill that really focus on patient and shared decision as well, develop an institutional standards for patient and family engagement, and develop practice of improvement based on patient experience. Next, please. While the stakeholders' role is they have to think of what are the opportunity if we are involving patient in research and how we can support and patient and family rights as well as clinicians and administration, how we can collaboratively work toward having a good input in our research. Not only this, the stakeholder could be playing a good role in disseminating a patient safety rights charter to all target group, advocate for participation of patient and family and communities in all patient safety planning and programs globally and nationally as well, share the best practice and lessons learned on patient and family engagement with their partners, and they can help create a community oversight mechanism for local healthcare facilities and local patient assistance programs. And WHO secretarial role, as we have said, that they are overseeing and monitoring all of these efforts, and they could come up with best practice. Can you go next, Yasmin? From the last conference on patient safety conference, they have been sharing with us all the best practice all around the world with those countries who have been working to implement the Global Patient Safety Action Plan. So Patient Safety Caravan was one of the best practice. Patient Safety Organization implementing Global Patient Safety Action Plan, community education on patient safety empowers their proactive participation in their care, patients and families, legislations to prevent patient harm, co-designing as well. Next, please. And creating patient family advisory council to partner with patient. Not only this, advocacy groups from all over the world, patient for patient safety, Asia Pacific. So with all these efforts, we are expanding and promoting the patient engagement and the patient safety, not on the healthcare level, also to the community level, which really shows that we are responding to patient needs and preferences, and we are taking a patient and their families as a partner in the healthcare sectors. Those efforts could not be done without hard worker team who has a belief and experience. Now we are back to Yasmin to talk to us about program administrator experience for those who are really taking it seriously and they are thinking how they are going to work with this program. Back to you, Yasmin.
Thank you, Makia. These strategies are quite helpful. As you said, it's gonna have the framework and the structure to support the healthcare implementation moving forward. So to do that, as we said before, as a program administrator, I'll talk from Axios perspective, how we evaluate that this program administrator the experience that this program administrator has is qualifies that person to start or initiate the PSP. So first of all, I will say the years of experience in PSP. PSP here we mean patient support programs, not patient support groups, just to clarify the difference. So we were saying the experience of patient support program service global and or local. And when we say experience in patient support program, it could be something that an HCP have been doing for decades, but they did not identify it as a patient support program. So if it maximizes the patient medical benefit, if it covers if it's still sustainable financially and operationally, it did not die in a short period of time, and if it follows the regulation, then you have been doing a patient support program for your patient, and it is important to identify that. Then the educational background, and here we keep saying that it should be by an HCP, someone in the medical field who knows how to do it and has the expertise and the educational background to start providing a healthcare service. And experience with the current client for current active programs. So in Shuruk's example, she has experience with the MOH system, so she was able to know who is her client and who are her patients to start developing the service. The program administrator also have the tools, and the tools that would help. Either it's with the involved stakeholder, or it should be like validated, published results that the patient they know of. And most of you, even if it's not validated or published, you will have results of your patients who have moved from a stage to another. Moving forward is the audit history, and we understand that even the governmental sector HCPs who are working in a MOH hospital or institutional hospital, they have multiple audits that's been doing throughout the year, either from Sibahi or if they have the international accreditation, or even from MOH itself, internal audit that happens all the time. Then after all, the successful record and regional coverage. So what are the guidelines that will help to ensure that all patient support programs are successful? First of all, it has to be based on patients. It has to address the patient needs. The patients has to be the heart of it all. So it cannot be from a pharmacist point of view. It cannot be from a nursing point of view or a physician point of view. It has to collect it all for the sake of the patient. So the patient point of view, the patient is at the center at it. Then we develop all the other perspectives within the patient. The second one, it should not be created for private or financial gain. So when Shuruk started her Ihtimam group, she did not want any financial gain out of it. She wanted to maximize the medical benefit. The patient, again, was at the heart of it. It should be set up in a way that meets objectives, and Shuruk set her objectives in that way. It should follow the high quality of standards as Makia explained the standards in the previous slides. It should implement robust compliance measures, and that is, as she said, it follows the international one and the local one, and it has to be sustainable in the long term. It shouldn't start for a couple of days, couple of weeks, or a couple of years and then shut off. Even Shuruk's, mashallah, she thrived during COVID and right after. It doubled the services, and that qualifies a patient support program. So again, based on these three pillars, what are the key considerations? First of all, is the involvement and engagement of a licensed and experienced HCPs to help them identify what needs to be delivered to those patients. So patients can thrive. Then the next one is to demonstrate how the treatment plan considered will strive for treatment completion. With that, we're saying that even the patient, once the patient is adherent to it, that should be continue as well for a full course of treatment. So we, as again we said, should ensure the stay on treatment as equal as the access itself. Then the sustainability, and with that we have the plan that maintain financially and will maintain operationally. And it should be cost effectiveness. With that, that's why we have multiple stakeholders to ensure that is sustainable, so it does not burden one payer into providing the service, and then it will burn all the funds, then the patients will not be able to benefit from it continuously. And lastly is the compliance with the local law and the international standards. Again, that's one of the ones of major importance, and it should be covered the ethical and it does not have or relate directly or indirectly to any commercial interest. We should also consider the data safety. We always talk about the patient and the treatment, but even the data safety is as important. So whenever we collect the data, we collect the consents of the patient, we align those data, and how we can help the HCPs understand which data they can share and they cannot share with the stakeholders that are involved in the treatment journey of the patient. Back to you, Makia.
That really shows how, as usually, our leaders asking us, how does it really this impacting or affecting the patient safety? We'll go to next slide. That shows a patient safety or a patient advocate can really improve the patient safety by reducing the near misses. So when recognizing the client was taking too high dose or blood medication, facilitating the timely transfer of client to an acute care facility from rehab facility when has developed signs of internal bleeding. So this concept, when it is really embedded in the patient and their families, and they know when to react and how to react, that's really could improve the near misses and adverse event as well. And this improve the communication between healthcare providers and patients as well. They will go in timely basis how they can react to their symptoms. They clarify the concept of how to deal with their medication as well. They can coordinate and communicate with the healthcare providers when and how to communicate with them when they have their education and their empowerment in a high level. Not only this, they will really react when to go and when not to go to emergency department as well. Go next, please. So back to you, Yasmin, to talk to us about the service and activities.
Yeah, so we talked a lot about support groups and مجموعة اهتمام. This is one of the services that can be provided. But what are the other services that we need or have? We can talk about the on-demand support care line, and we have that embedded in وزارة الصحة as the 937. We have also other on-demand care line services that are provided from other patient support program providers to stay with the patient, or and in our programs, we have that to call the patients proactively, to help the patient think of what is missing. We have to help the patient understand that what services are missing from their daily journey, to help them to cope with their disease, to increase the compliance, to increase their stay on treatment, to decrease the dropouts or change of medication or adherence. How can we support with that? To observe their day-to-day life and to figure out what are the challenges and obstacles, and then to speak it up, to help us to provide and customize a service to help them overcome that, and to identify it in other patients' journey as well. Then the treatment and disease education, and lots of people say HCPs are the worst patients, and I understand that because they do have the knowledge, but sometimes even HCPs, they want to have the education about the treatment. They do not want to be spoken to as an HCP. They want to be spoken to as patients, to explain to them the whole idea of the disease, the treatment, and what to do, what not to do. Even though they are HCPs and they have the experience, they want to listen to it again. So that should be one of the services, one of the things that we provide to those patients. The follow-up activities, and that includes multiple services to that is provided, and that's not only the demand care line or follow-ups through calls, that's even support with the hospital setting to follow up with the patient on a medical report, for example, that a patient needs. So follow-up activities are enormous and huge that can support patients. Then the patient and caregiver guidance and empowerment. And again, not only a patient needs the support, even the caregiver needs the support, because lots of caregiver, they need to be strong and they need to know how to handle the patient so that the patient does not have to be a patient and the person who holds up the family. Access to HCP supports activities, and here we talked about the empowerment and how we can help the HCPs to know more about the chronic diseases so they'll be able to empower more their patients. So they always say the good coach has the good student. So when we can empower our HCPs, then we can empower our patients through our HCPs. Then the quantification and qualification of patient needs. And again, as I said, once we have it proactively and once we understand the perspective on those patients, we will be able to identify those needs through identifying the gaps, the barriers, the struggles that the patient faces on a day-to-day basis. The remote services, and here we have multiple services that are being provided remotely currently, as the home care, the physiotherapy sessions, the home administration, the nursing care. There are hundreds of the mobile services and the services that you discussed, Makia and Shuruk. As well, we have the text and reminders activities, and we always receive presently messages about how to keep up with our health. General message either from MOH or from other stakeholders. Sometimes it's a simple greetings about our awareness about a specific World Health Day. Then the patient forum, and as I discussed, this has shown enormous impact on our patients in our program and how they became empowered to even suggest the next topic or demand the next speech and the next area of coverage with it. As you said, Makia, is it psychological, physiotherapist, is it a nutritionist, is it a physician, or whichever a health practitioner they need to listen to, a dietitian or even more. The psychosocial support activities, and it can be surprising how patient might need lots of things away from the disease and the treatment. area. Sometimes they just need a person to talk to, and that a patient told me personally is that it is nice to have someone out of my family to talk freely with about my disease and my condition. So it could be as simple as that. The HCP support activities, the treatment initiation support, and as the case I talked to you about my patient who had a treatment that is subcutaneous, who needed her caregiver to start supporting, so how we can support the patient and the caregiver to initiate their medication and start it, and the availability of the medication as well. Then the people-related support, and I liked and when you talked about the Saudi standards Makia, I like that it said human-centered care, not patient-centered care. It even generalized it. So that is actually, we're aligned with that to provide support to a person as a person, not only as a patient. So we've talked about that much, and I want to specify that in numbers. So we, as Axios, we provided that throughout the past 25, even more than 25 years ago. We've been providing that patient support. We have done that in more than 100 countries. Up until now, we've supported 9.5 million patients under patient support programs with our employees in 43 offices. We have covered over 50 disease areas, and within these 50 disease areas, we have over 230 active access and patient support projects. We are, as mentioned before, we have the pharmaceutical company. We use the CSR of the pharmaceutical company as a sustainable part of the financial funding. So we are dealing with the top 20 pharmaceutical companies, and we have over 2,000 stakeholders that are also involved in the patient journey and the patient support programs. In KSA, we have over 1,300 patients, and we have not started long ago in KSA. I know the Access is over 25 years of experience, but in KSA, we recently, in the past couple of years, we started in KSA exactly in 2017, and we have now been able to raise the awareness on what are the patient support program, what is the concept of patient support program, what is the regulations, and how we can develop regulations for patient support program in the kingdom, giving it that it's a new concept. Then we were able to initiate it, to monitor it, to have it governed, and to start enrolling patients. So up until now, we started to have 1,300 patients. We have over 200 CPs participating. We have over 50 hospitals, and we're talking about MOH institution and private hospitals involved. And we have over 20 stakeholders. We have over 15 key opinion leaders who are supporting patient support programs in their area, and they are pushing to have one if they do not have it in their area. And we have over 20 sponsors for our services.
Wonderful. Yes, just let me just comment on that. You have a wonderful activities. I like the idea of having a basket of services, and really your impressive data reflect the huge efforts you have been done through 2 decades, and it shows it's really actually actions speakers louder than words. But you have a great efforts, and thank you for what you have been done for patients and communities. What about you, Shuru? Can you share us how expanding you in our kingdom?
Yeah, very impressive what had been Yasmin is showing us for the Axios Institute. However, the support, the group support program or ihtimam groups is in the Saudi Arabia since 2017, as I said, and we are founded in 20 regions of the kingdom. We are founded in the primary health cares. We are in the specialized primary health care, like the diabetes center, the kidney centers, also the hospitals association, governmental, non-governmental association. We have working together also. Um, uh, as I said in the objectives, we are looking forward to improve our quality of work and support group programs and ihtimam groups. We are looking forward to have the to maximize the benefit for all our members and support groups. So we are having alhamdulillah, we are having satisfaction more than 95% for the last 2 years of our beneficiaries for support groups. Also, if you can go to the next slide, Yasmin, support group program is had excellence award for the year of 2018 as the one of the best programs in primary health care assistance agency of the Ministry of Health. Also to improve the program and to facilitate the maximum benefit for all our members, we are trying to having influential expert with us. The next slide, Yasmin. We had to increase the knowledge. First, we are trying to measure and to know what our members trying to have the knowledge of, or what are they have the difficulties or the support they need. And then we have invited some of the experts and influencers in the society in Saudi Arabia and the health care precise. We had, like you can see, Dr. Ahmed Al Ammar, Dr. Ahmed Al Ammar was talking about the obesity. Dr. Amal Kinana also talking about the obesity. Also, Dr. Iman Al Shahri from the diabetes organization is talking about diabetes in one of the meetings in Zoom meeting for the members. And the next slide, please. Um, our activities and our meetings and support groups, we are trying not to only stay in the primary healthcare in the setting. We are trying to go outside the centers to see where is the special need of the patients, and we work on it. As you can see, some of the groups was needing the physical activity uh, for the chronic disease and the old women. They need physical activity. So the facilitator say, set a meeting outside the center. They go and to walk through the parks in the region. Also, if the need for the information if the need of the knowledge for the patient was special for the food or the healthy choices, the facilitators set a meeting in the supermarket to know where to give them the knowledge what they buy and what they get for their special case. One of the meetings was set for a psychological need and psychological support for the group, for ihtimam group, was set in a coffee shop. All the group members go there and meet with um, I don't know, a specialist. To psychiatric specialist. I don't know if it's correct or not. Sorry for that. Set a meeting with him to get them the emotional support they need. So the support group or ihtimam is not only found in the setting. We are the support group. We are trying to be everywhere for the patient if they need, and to get the good support they need and the care. After that, you can go, Miss Makia. Can you?
Thank you, Shuruk. It seems that you are hitting the target by visiting the people. Where are they? You are not waiting for the patient and their families to come to you. You are trying to go to them where they are gathering together, where they are grouping together. So you want to prove yourself and your patient support group concept, even by targeting the people within the community. Thank you for these efforts. Actually, we are just coming by the last 15 minutes of our webinar with a really fruitful lessons learned, and we have a lot of pictures just to show you that patient engagement and patient advocacy is doable and achievable. You can see those two posters. We are having Hakaya Salama. It was like a space of Twitters where people are coming from different disease, chronic disease, and we have different professionals sharing their ideas about how to be safe and how to live safe. Not only this, we are having Salamati Bidun Filter, My Safe Without Filter, where Dr. Nizar Bahabri was gathering with more than 3 ex-patient with MS patient, cancer survivor, and leukemia, and other people who were sharing their real stories with unsafe acts, communication issues, lifestyle issues, a lot of things that impacting their safety. Also, we were having home care programs were customized, which was really customized to the needs of patients, of home care patients, how they can take care of themselves, how the caregiver can take care of his families and his partners. NGOs was part of those efforts, amazing efforts. They were sponsoring these efforts. They were part of this advocacy during implementation and designing the programs as well. Back to you, Yasmin.
Thank you, Makia, and thank you, Shuruk. Those are truly inspiring stories that you have, and it really go through everything, single thing that we've been talking about. For us in Axios, I would like to show you a couple of pictures with the start of the idea. So in 1997, the first idea of Axios and Patient Support Program was established from former members of WHO. By that time, by 2000, the year of 2000, you can see the Axios office and the old logo on that. And soon after, in 2001, was the first one of the first programs for the people, for the patients, and how to help to educate them and minimize the transmission of HIV/AIDS. Then in 2007, we were able in Axios to expand the service and launch cost-sharing programs in 10 other countries to help support patients, including several countries in Asia. Then in 2012, it expanded to Middle East. And then right after that, we expanded in Asia, including the National Society in Malaysia. Then we were, after a couple of years, we were able to be in Saudi, and not only in Saudi, we established in 2017. And then we were able, after a couple of years, to partner with key stakeholders to be able to implement the idea of patient support program in Saudi as well, under the umbrella of a private company. So if you remember, I told you the two stories about my two patients who, the first one, he did not visit the physician for 5 years, and the second one who was waiting for the caregiver to provide the injection. The first one, after she joined the patient support program, she went to the hospital and she figured out that there was indeed silent attacks that happened. And after that, she started to adhere to her treating physician instructions. She did not miss a single hospital visit or lab work, and she would wait for our proactive calls. And if sometimes she would initiate the call to tell us the updates of her status. So she now is taking her informed decision to stick to her treatment, to be compliant, to stay on treatment, and to adhere to her treating physician behavior. The second patient, we stayed with her and empowered her step by step until she was able to take her first injection by herself. And the second time, on the third time, she called us 10 minutes earlier on our scheduled call to inform us that she took her injection on her own. So how great is that impact on her life, that she is able to take her treatment without the need to rely on someone else? What's the limit to that empowerment? What change that empowerment can have on this patient's life? Allow me to disconnect the screen for a minute so I can allow you to hear the voice of this lovely video about مجموعة اهتمام from شروق.
Take your time, Yasmin.
Let me know if you can see my screen.
Yes, we can see it.
Okay,
Can just
I'll
make
start
sure.
the video.
Okay.
السلام عليكم أصدقائي، أنا اسمي سعود العمري.
Everyone can hear سعود العمري's voice?
Yes.
Okay, perfect.
عمري 5 سنوات. أنا سكري من النوع الأول. السكر هو ما مرض، هو صديقي.
سعود ابني عمره 5 سنوات، أصيب بالسكري 23 أغسطس. تقريبا كان عمره 3 سنوات ونص أول ما أصيب سعود بالسكري. واجهتنا صعوبات كثير أنا ووالده، كان من أهم الصعوبات اللي يعني تعبنا فيها أنا وأبوه. كيف سعود حيتقبل الإبرة، كيف حيتحمل ألمها، يعني 5 مرات كانت الجرعات كثيرة. فتعبنا في البداية وتعبنا في التحليل، كيف حيتقبل التحليل قبل كل جرعة. بس الحمد لله يا رب لك الحمد اتجاوزناها.
السكر خليني آكل الأكل المفيد، أو تعطيني إبرة الأنسولين ما توجع، أنا قوي. ماما وبابا يقولوا لي أنا بطل.
قبل فترة واجهني موقف، كان أول موقف أعدي فيه مع سعود. من وقت ما صحي سعود الوضع مو طبيعي، يعني أنا حاسة سعود مو سعود اللي أنا متعودة عليه، نشاطه مو مزبوط، وجهه شاحب بزيادة، في سواد تحت عينه. فلما حللت له السكر كان السكر جدا مرتفع، استمر الوضع، أخذ جرعاته لكن ما زال السكر مرتفع. حللت له الحموضة وكان عنده للأسف الحموضة جدا عالية، وكان المفروض يروح المستشفى لأنه بدأ يفقد الوعي بدت عليه علامات. أنا كنت خايفة. استشرت الدكتور المشرف على حالته، قال لي إنه الأفضل أعطيه جرعة تصحيحية كل 2 ساعات ويشرب موية ويمشي، هذا هو الأفضل. حستمر على هذا الحال، وبالفعل استمريت أعطيه موية يمشي، موية ويمشي، وكل 2 ساعات جرعة تصحيحية. الحمد لله تقريبا بعد 6 ساعات بالضبط رجع الوضع طبيعي. في هذه الفترة تعرفت على مجموعة اهتمام، انضميت للمجموعة الحمد لله، واستفدت منها يا رب لك الحمد، جدا استفدت منها، الله يعطيهم العافية والحمد لله.
أنا مصاب بس ما مريض، أنا أقدر، أنتوا تقدرون.
It's really nice video which shows the impact on a real patient. Thank you, Shuruk, for sharing this video. I think we come up with the last presentation, and let's have an agreement that this effort can't be done without strong governance, including not limited to approved communications and education materials, maintaining the sustainability through the efficient operation process on all levels of involved stakeholders, high standards of quality provided services, and ensured by consistent process and qualified MDT. So we are all patient safety advocate, and we could change not only our culture, we can change the world toward promoting patient safety in general. So we are waiting for your questions and answer before the end of this webinar. Until our participant can just share their questions, let me call Shuruk and Yasmin to the stage and asking you about the wonderful and fabulous efforts that really you have been sharing in this night. I was really enjoying all the things and challenging those people who sometimes said that it's not achievable and it's so hard. We have a lot of challenges. So we come up with an agreement that those things could be done and it's achievable. You can approach Shuruk to embedded this patient support group. If you are working with primary healthcare centers, you can approach Yasmin as well to have the lessons learned relating to patient support programs. Any questions from our participants?
I can see 2 participants raising their hand, Makia. If you can allow them to use their mic.
I think the IT have to Hello, Mike. Abdurrahman. Rashad, do you have something to share?
You're allowed to speak now through the mic. You just need to unmute.
Those who are raising hand, do you have something to participate or to share?
Please, if you're speaking, unmute yourself so we'd be able to hear you.
Vamelia Johnson. Okay, I think it's by mistake. They are just raising their hands because they have no problem with a mic at all. It was a wonderful sessions with wonderful speakers. On behalf of Saudi Patient Safety Center, I would like to thank you, our speakers, Shuruk and Yasmin, for their really impressive presentations and the informative sessions. Also, you, our participant, for keeping and engaging with us all the time. And as a part of Saudi Patient Safety Center's effort, we would love to promise that we will provide you with the timely topics and interesting speakers. We appreciate if you would fill up the evaluation survey, which was provided by Rawan at the end of the session. Thank you for joining us today, and we look forward to welcoming you back in the futures.
Thank you.
Thank you.
Thank you, Makia, for having us, and thank you everyone for sticking to us until the end of our session.
Thank you all.
Thank you, Yasmin. Thank you, Makia. Thank you, the Patient Safety Center, for the opportunity to be with you today. Thank you all for listening to us.